America, Word Talk Radio. This is Dr. Tong Lee, your host, here with my co-host,
Wilhelm, who is having a great time on the show, by the way. This is something that may become very applicable to me. We've always talked about that I'm a light sleeper and my wife is a deep sleeper, but we might find out why I'm a light sleeper. We'll have to tell you more. Now, speaking of, if you have a similar issue, you're a light sleeper all the way through, do you know for sure that you're just exhausted when you get up every morning and you can't figure out how to get good sleep, then we have a website for you to go to.
Yeah, there is, and I'm just right now. It's I'm gonna pull out my phone and I'm gonna have because there's an attachment. There's an attachment to the squeeze page.
Oh, okay.
So I'm gonna have them go directly to it, so they don't have to bypass and hit a lot of buttons. But I'm gonna look for it right now.
Okay.
Well, we'll get back to
Okay, great.
Yeah.
But anyways, I want to talk about actually a few more things that, in addition to what we call mandibular advanced device. That sounds like
what they do.
Mark has been talking about. There's also tongue device that makes the tongue retracted out.
Okay.
So it's, these are the devices that's out there in addition to CPAP.
So between the CPAP, the tongue one, and the mandibular device,
advancement device.
The advancement device. What is the actual name of your brand?
Well, it's a Herbst oral appliance.
There we go.
And it's not really anything that I sell. It's a medical device. I'm bringing awareness to people that this is a great option for them. And it works for me. There's lots of different oral appliances that are out there. I feel this one works the best. It allows your jaw to move freely. I can wake up in the middle of the night and take a drink of water. I can talk on the phone if I have to.
Oh, wow.
You can yawn. Many of them are situated so you're not allowed that much movement, and it kind of maintains your closed mouth position. But I really like the one that I have because it works so well.
Even though a lot of chiropractors would probably prefer that you sleep on your back, this also allows, if you're anything like me, I wander around in different positions throughout the night, and so me having a CPAP or something that doesn't allow me to go to my side once in a while would frustrate me to death. So
you have to hear this one.
Okay, let's hear it.
This is a trick people have been studying that is using tennis balls.
Oh.
So you put a few of them in the sock. And pin it to a clothes on the back.
Oh.
So when you're unconsciously rolling to your back, you're going to be sleeping on the balls. So it's not going to feel good, so you're going to turn back to your side.
Oh, gotcha.
They actually did a study on 50 people. After, I think, 5 months or 3 months, there's still 32 of them kept using those balls because they liked the method.
Oh.
And it worked.
Oh, that's
so
great.
Sleeping on the side does help to get the tongue out of the way because when you're laying flat, the gravity brings it back.
Sure.
When you're sleeping on the side, it doesn't quite go to the back of the tongue. The tongue doesn't go back to the back of the throat as
I do
much.
find I'm almost never snored when I'm on my side. However, it isn't as good for your back, and we're looking at overall health. So between the two, if you have a way to be able to sleep on your back and not snore and have a great night's rest, I tend to be a fan of Mark's product here.
I don't know if there's a perfect position to sleep. I mean, there's something good for this and something good for that. So if you can use other ways to get yourself not snoring, then you can sleep many positions.
Yeah.
I mean, alternatively,
You betcha. One of the best things about health, in other words, the biggest contributor you're talking about is just getting a good night's rest. So however you do that, as long as it's not chemically induced.
Hey, I do hear that sleeping on the back is really good for the wrinkles.
Probably too. I actually used to sleep on my stomach, if you can imagine that. So not good for wrinkles. You're wrinkling the side of your neck all night long, and also your vertebrae
Just
completely out of whack.
little details.
Yeah. All right. Well, thank you for kernels of wisdom here. Go ahead.
So there are also some throat exercises you can do.
Okay.
We're dealing with a muscle and tissue tension issue. So because of aging, because of obesity, because of a redundant tissue, basically losing it's tension when you're sleeping, when it's really, really relaxed. So there's some efforts put into the experiment of trying to see if throat exercise would help. Well, one of the easiest throat exercise is singing.
Really?
Yes. So there are actually people posting.
Sing yourself to sleep?
No. These are regular exercises to
Oh.
strengthen your airway muscles.
Oh.
So when you're sleeping, it doesn't flop as much. So they say singing half an hour every day. It's not only good for your lungs, for your, capacity of your lungs, and also it's good for the muscles in the airway. It can help with the snoring. There are people actually posting these results in the internet saying, it's worked for me.
Well, that is great.
That's only one exercise. There are other ones too, playing, how do you say this instrument? Didgeridoo.
I have never even heard of that. What is it?
It's a trumpet. It's a flute.
Didgeridoo.
Like an oboe?
It's an Australian
Oh.
type of an instrument. You blow on it,
Okay.
and that exercises your muscle in your oral airway and the pharyngeal airway area.
Uh-huh.
That helps if you want to go that far. It's a musical instrument.
Okay, let's spell it. So in case there's
It's
any
D-I-D-G-E-R-I-D-O-O.
Just show it. I am not that culturally aware as I
Didgeridoo.
should be. What's that?
Didgeridoo.
Didgeridoo.
Oh,
yes.
didgeridoo. We actually have somebody who knows what one
Yes.
is. Does it sound good? Sound pretty cool? All right.
Yes.
Our photographer is sharing information
Absolutely.
with us. Okay.
And
great.
also you can do the throat exercise like pronouncing the vowels, A-E-I-O-U,
Okay.
but 3 minutes on each of them.
Oh,
So
wow.
it's good exercise. You tense up the muscle, you actually train the muscles.
Very good. Shower in the morning.
There you go. So there's some things you can do at home in addition to seeing the doctor to check out to see how severe it is. Do you really need to live in a hospital for a while?
Okay.
Or getting the device right away, like Mark did.
Since it's holiday season, we joined our church choir recently, and who knows, maybe that'll help.
So singing is a
Handel's
good
Messiah,
exercise.
you can belt it out. There you go.
Yes.
Holiday season.
So did you get the website?
Yeah, I do have the website here, and this is the website. It's It's specials.proplayerssleep.com.
Okay, and pro players with an S.
Yeah, so it's specials.proplayerssleep.com/Walczak. That's me, Mark Walczak, Walczak. And that will take you directly to my site, which will allow you to sign up and fill out some information. You'll be contacted if you're interested in getting a sleep test. They will send you a sleep test directly to your home, and they will get you a referral to a doctor in your local area that can facilitate a oral appliance.
Wonderful. We really appreciate you coming and sharing that with us. And so in the fitting process, then they also might be able to get that diagnosis as well. In other words, that sleep test.
Well, the sleep test comes first, right?
Okay.
And so what they'll do is they'll send you a sleep test. They'll show you how to set it up. There's instructions that come with it. It's very simple. And then what they'll do is they will contact you and have you take that sleep test to a local doctor that can read it out and give you a diagnosis of what your severity or levels of severity are. And then they will, if they say yes, you have sleep apnea, here's your choices. Your choices are, if you want a CPAP, they will find you a CPAP. If you want an oral appliance, they will fit you with a dental oral appliance like the Herbst device like I have.
Okay, very
That's
good.
another thing about what to choose, what kind of treatment device to use, is related to every individual differently. Everybody has a different situation, even the end result is sleep apnea. It can be caused by different anatomies, different, some people have a weight issue, some people have a muscle issue, anatomical variation. So have it checked out is the best way to go.
Right, and the great thing about our sleep test, it also can test for central apnea.
Okay.
And central apnea is far different than obstructive apnea. Central apnea occurs, which is a neurological problem, happens in the brain.
Okay.
And for some reason, your brain is not triggering your airway or your lungs to continue to breathe. And there's people that do have that, and for that situation, the CPAP is what you have to use,
I see.
and or they can also prescribe dual therapy. You can wear a CPAP and an oral appliance, which I think is the greatest idea because you're not only allowing yourself the air, but you're also removing the obstruction with the oral appliance. I relate this to plumbing. If you have a clogged drain and you call a plumber up, and what he's going to suggest you do is clear the obstruction.
Sure.
But he's not going to tell you, well, we're going to force more water past it.
Right.
So
Right.
my thing here is, if you have an obstruction, and that's what sleep apnea is about, why not remove the obstruction with an oral appliance that moves your jaw forward and allows you to sleep and clear your airway? And on top of that, if you still need to have more assistance, then you can use a CPAP, but you can turn the pressure way down. You don't have to have such drastic pressure forcing so much air because you're halfway there with the oral appliance.
Exactly.
Well, you've made me a big fan anyway.
Yeah, no, it's great, and like I said, it's very satisfying to be able to reach people because there's a lot of people who are suffering from sleep apnea and don't realize it, or they're afraid to say, well, listen, I can't use the CPAP, and what do I do now? Or I want to, trying to use the CPAP, or there's alternatives out there for them to be able to get relief from this and to be able to sleep better and to increase their health. The downsides of having sleep apnea are gigantic. There's onset of diabetes. There's heart problems. There's stress on your heart. There's
It causes you to gain weight
scar
too if you don't sleep
exactly
well.
scar tissue in your heart, gaining weight, right? Because your body's not metabolizing. You're not resetting your clock. You're not rebooting your computer, which is your brain. If you don't reach REM sleep or level 4 sleep at night and every night on a consistent basis, you're gonna have some dramatic health problems.
You bet. We're going to talk more about that when we come back from break, and we'll also give you a couple of health tips that you can take with you along the way as well. So don't go away. We'll be right back after the break.